Welcome to Psychoanalysis and You, the podcast of the American Psychoanalytic Association. I'm your host, Dr. Gail Saltz. I'm a psychoanalyst and a psychiatrist. This is Psychoanalysis and You. My guest today is Dr. Beverly Stoute, a child, adolescent, and adult psychiatrist and psychoanalyst. She's also an executive coach and organizational consultant, and serves as a co-chair of the Combs Commission on Racial Equity in the American Psychoanalytic Association, and has served on the organization's board of directors. She serves on the faculties of multiple psychoanalytic training programs, the Emory University School of Medicine, the Morehouse School of Medicine, and has taught at the Emory Business School in the Executive Coaching and Leadership Fellows Program. As an internationally recognized speaker, author, educator, clinician, and organizational consultant, she has expertise in psychoanalytic training and education, in diversity and leadership development, on implicit bias in healthcare, on the integrative psychoanalytic treatment approaches for children and adolescents with complex psychiatric illness, and the forensic evaluation of complex trauma. Her innovative scholarship on the developmental aspects of implicit bias and diversity awareness is on the cutting edge of expanding psychoanalytic theory. And her 2023 book, co-edited with Michael Slevin, is entitled The Trauma of Racism: Lessons from the Therapeutic Encounter. And she is in full-time private practice in Atlanta, Georgia. Welcome, Dr. Stout.
Thank you very much.
So delighted to have you. And this really is your area of expertise. You've done a lot of work looking at the problem of racism, in particular, its origins and the problem of implicit bias. So can you explain for us what implicit bias really is and how it develops, and actually when developmentally it does develop?
Thank you very much, Dr. Saltz. It's wonderful to be here with you. I think perhaps I could give you my perspective that led me in to think about this material, because I think being someone who works with children, I think it gives you a really different lens on thinking about and trying to understand people. I also think, even though it seems like I have a lot of things I do, I think they all boil down to seeing people and problems developmentally. And every person comes with parents, family, community, culture when they come into your office. And I think no matter where we are positioned, even as individuals or in groups or in companies, we're always that person that we bring with us. So when I first started thinking about the idea of how do we think about bias in a way that's helpful for people, I thought, how does it start? If we understood how we came to this position from childhood forward, then wouldn't it allow us to have a greater understanding and compassion for where we are now and who we used to be as children? So when I speak, I always show a huge slide of infants smiling, all different groups are represented. And I said, that's where we started. So how did we get here? The other thing that I think in order to understand it is you need to integrate. I think this is an area, if we helped people understand that psychoanalytic thinking is just so useful and so powerful, because it teaches us how to take data about different things and integrate them into understanding who we are and how we become who we are. So I sort of like to start there, because it's more of a perspective that if you sort of move me of development, you'd think, oh my God, of course, I understand it. So many people talk about what implicit bias is, and I think it's one of those popular concepts that's really based on foundational psychoanalytic thinking. Sort of the idea that, one, that there is such a thing as the unconscious is one of those mundane concepts that is in our culture, but it's psychoanalytic at its very core. So the idea that there are things in our mind that we may not know. So for example, I may not be thinking about what I had for breakfast last week, and it's stored in my mind, but it's not in my conscious mind for me to think about it. I might be able to retrieve it if someone asks me a question that triggers that, but I might not.
And that applies to bias, to
Yes.
implicit bias.
Yes.
So Explain to us
So
how.
bias means that in our conscious mind, we think one thing about people. Gee, I see you and I see who you are now, and I think I have a good feeling. In my unconscious mind are all these experiences that I don't even remember, and all these images from our culture that I've seen in the course of development, but I may not even be able to call up. And those impact how I actually see. So, for example, I might walk down the street and see someone and feel perfectly fine. But if I see someone, for example, a person of color, and I'm not a person of color, that might give me a startle response. Not even based on if I'm walking sort of down the street in front of the hotel, which is a fairly nice, safe neighborhood. But that person may elicit a response in my mind that's not what I presently think, but calls up some experience in my past. So the way this comes out, for example, in healthcare, very simple study was done, I think, in 2021 during the pandemic. It showed that if therapists got phone calls and they perceived that the person on the phone was Black, or they thought that, they were less likely and slower to return the call to offer treatment. Not that they even were aware of this. The study found this by examining the amount of time it took them to return calls. So that's an example of mostly, I think we can think that most mental health clinicians go into healthcare because they want to be helpful and they think good about people. But why did that particular factor make the person slower? The person may not even realize that they had that reaction or even know where it comes from. So that represents itself in so many ways in the way that we're open or not. It accepts for this way, for example, in the way that we diagnose. Some patients are more often recommended for certain kinds of treatment. Certain patients are not really seen to have pain, and these are all stratified according to gender and race. But we don't even always think it consciously. So implicit bias can be on the basis of many factors. We most often talk about it in terms of race and gender, because those are the most commonly thought about in our society, and they're the most commonly thought about as bases for discrimination.
And how early do children start registering implicit bias?
Well, so this is, to me, this is the most powerful thing. It's shocking to me that the studies that showed us a lot about race awareness go back to the 1940s and 50s. So you would think that we talk more about it in training. At 3 months of age, you know the face that's of the same race. But by 6 months of age, an infant will have a longer gaze at a face of a different race. Well, so that makes sense, sort of, because it assumes that evolution will assume that your mother is of the same species and of the same race. Makes sense. Now, as you get older, how your parents handle your exposure to people of different cultures has great influence for children in these years. So by the time you're 3, about 37% in the classic studies of children will actually know that there are 2 races. They'll be able to recognize that there is race and that they might have one. In the course of development for 3, 4, 5, 6, 7, by then, 87% of children know their race. And that's based on the classic studies by Kenneth and Mamie Clark in the early 1950s, whose data was used in the Supreme Court decision in 1954, Brown versus the Board of Education of Topeka, because they demonstrated that racial segregation was detrimental to children of color. Now, as you go through those ages, by age 4, you actually know not only are there 2 races, but that white skin is better.
By age 4,
And by
children
age,
of color
all children,
and white children will
they
say
see
themselves,
they see there's a preference.
and is the understanding of the implicit bias involved in that, obviously, that comes from environmental experiences.
It's from the culture and from what our parents transmit to us. But imagine then by 4 to 5, you start to go to nursery school and maybe to school. So by 5, you know that not only is white skin preferred, but black skin is not preferred. And then the classic studies show that by age 6, when Kenneth and Mamie Clark did the doll studies, that black children will pick out the white doll as preferred. And they will pick out the black doll as the bad. And if you look at them on Google, you'll see that the children actually cried as they did it. So they had some awareness that there was something negative. So by that time, they've actually internalized some negative view of race, but then that negative view of race becomes internalized into the child's self-concept. So by the time then you get to middle childhood, you know which group you belong to based on gender or race often. And then by adolescence, you know who I pick matters. And what happens really in those ages is that parental influence then becomes really important because by middle childhood going into adolescence, there's a bifurcation in terms of development. Parents of color, African American parents, start to educate their children about bias discrimination. White parents tend not to. In fact, studies show that about 60 to 70% of white parents rarely discuss race in this period. Because for the most part, if you don't live in a neighborhood where you're exposed to it or diverse, you don't really think race is as salient to day-to-day development. The other thing that happens then going into adolescence is that legal socialization becomes important. So for Black children, that's very defining as an adolescent, especially as an adolescent male, whereas white children tend not to be socialized that way. And then what happens is, more often than not, studies show parents like to teach them that we are all equal and it's egalitarian. But that actually is a setup, I think. That means then if you don't really get education on how to talk about these issues, and if families don't talk about it, then you're really not aware of it. So what happens by the time you get to adulthood in a very simple way is that you have a binary way of thinking about the world. We like to think about that it's just racism, but another way of thinking about it in my mind is that the way we see the world is stratified according to race. In my mind, I like to use the term racialized thinking. And then if you actually don't think about it and no one told you, hey, this is a thing and it happens to people and we should all think about it and this is the way it comes out, then you actually don't even really know. So if you do studies, there are parents who would like to talk about this with their parents who are white, but a lot of them in studies said, gosh, I don't even know how. So what happens when you get, for example, the reason why I go back in time for clinicians is that when clinicians have to talk about these issues with their patients, they actually don't know how. Most training programs don't teach. What do you do, especially during the pandemic when everyone was talking about it? What's a useful way to even engage someone in a conversation about why this even matters? And people miss it. They not only miss how to talk about it, but they miss the traumatic experiences that people have that we actually can intervene with helping them therapeutically.
Is the first traumatic experience really for a child of color this idea that you're saying that then becomes sort of unconscious, that they're not preferred, that they're not the preferred skin color? Is that like an initial trauma?
Well, I think it depends. So it's not a trauma. It's, trauma can be seen in many ways. It's cumulative. It's cumulative. And by the time you get in school, it's frequent and ongoing. At early ages, children don't often know what that means because they don't have the cognitive capacity or the language to be able to label it, but they do internalize the sense of being treated differently and being treated differently in a negative way. And in schools, teachers often transmit these negative attitudes in the way that they engage children in learning or the way they assume some children are not capable of learning. And teachers also miss opportunities where they can teach children, hey, you know something, we all have to look at each other in a way that helps us all be part of this. Because play situations, the reason why we know a lot about this is that researchers actually looked at play situations to see which kids pushed kids away and invited kids in. And kids do this on the basis of race if they are exposed to that in the surrounding culture. So what happens is a lot of times children don't actually know, quote unquote, but they experience it. Like, this is one of the more powerful pieces of psychoanalytic thinking too, that we can have things happen in development that affect us, but the impact of that comes out later. And it comes out later as we're exposed to other traumatic experiences, or studies will show us then that as you get older into adolescence, the number of discriminatory experiences that you experience not only increase, but you begin to become aware, hey, this is what it is about. And traumas now actually trigger traumas in the past. Sort of like somebody's who's had an awful thing happen. Let's say you're a Vietnam vet. You came home and you're doing fine, and you hear a banging sound in the back, and all of a sudden you hear the guns in your head. It's the same. Post-traumatic experiences are post-traumatic experiences, no matter what locus of our identity or development that it calls for. So those later experiences then trigger earlier experiences. So the sense of negative devaluation, poor self-concept, constantly having to prove that you're as good as the next kid, those are internalized and come out later in adolescence. And actually, when you talk with academics who are in academic circles. But the other thing that's parallel with that is that white children have internalized the sense that Black is negative.
So, as psychoanalysts do, see talking about and listening to as paramount in making change. From a public perspective, if we are to make any inroads in this issue, what role can psychoanalysts play in educating the public about these conversations that you're saying really need to be happening at a very early stage?
To me, that is such a simple statement, but it's very hard to get consensus on how to do that, partly because a lot of the people who make these decisions themselves, don't really know the data and understand it. It always strikes me that there are not more people with experiences with children who are involved in educating. Training programs rarely educate about this. So the generation that makes this decision is not really aware. The other thing that I think begins to happen is as people get older, the people who make the decisions already have these attitudes solidified in their own minds. And there's so much difficulty for us to think about the simple idea that there is something in my mind I can't control. I say sometimes when I speak to people that racism, one definition of structural racism is like really good people get together and try to do something right. And the system is set up where it doesn't come out that way and one group still has the advantage. That's, to me, the ultimate of what implicit bias means. It's that we try, but there's something that we're not aware of that holds us back. But to open up that conversation is really very, very difficult. And I think also that we are all not aware and able to talk about our own sense of identity, realize that the cultural norm is to pretend that people are white or Black, not that the real world is much more diverse than that. And that secondly, we just don't talk about those things. Like we don't talk about the foundational traumas of our country. I was thinking about it when you told me we're going to talk about trauma. From a psychoanalytic perspective, the United States is a country that was founded on trauma. People fled here because they were experiencing discrimination and harm. They brought with them their traumas. Then they started a country trying to be free and equal, but they only inflicted traumas on other people to do that. So psychoanalytically, one, trauma impacts us and it doesn't go away if you don't talk about it. In fact, it's stored in our minds and it's stored in our bodies physiologically. And no matter what we do, we will repeat it unless we learn how to talk about it. And then secondly, there's some people who'll say, I'll try to do better. But no matter how we try to do better, sometimes we end up enjoying doing to others what was done to us. You see kids do that all the time. And if you don't help people understand how to interrupt that pattern, we will never get to a better place. But from an analytic perspective, we are all wired that way. How do we begin to learn to help people talk about it and say, for example, South Africa has done a better job in some ways, and so is Germany. They say, hey, guys, we're putting out things, so we just got to talk about it. But it is fracturing to all of us, I believe, maybe for different reasons because we each have a different culture and background. So in order to do that, we have to say, we're going to have a really hard time. But how do we begin down to take all of this data that exists and integrate it into education and training? And my main role is as a clinician, although when I speak to people who work in organizations, when they come to understand the way in which it's impacting them, it's powerful to begin to think about, oh, how do I step back from it? But if we normalize it, I think, then it takes some of the shame out of it. And I think feeling the shame of awful things being done is a cultural problem for all of us.
I'm reminded of, during psychoanalytic training, how often we would say, is this person analyzable?
Hmm.
And that they needed a certain amount of capacity for intellectual insight, let's say, right? And a motivation because of their own personal suffering and a belief that this could help relieve their personal suffering to be able to meaningfully participate. And so now, really, what you're talking about is how do you make an entire nation, how do you prep them to be analyzable, or, how do you prep them to have intellectual insight that their identification with the aggressor in certain instances, for
Hmm.
example, is, let's say, an understandable defense mechanism that doesn't make them a bad person through and through, and that they can feel not good about the outcome of utilizing that defense mechanism, but not so shamed that they have to suppress it all and can't make change. So, like, on a larger level, that seems like a huge challenge.
Yeah.
Well, clearly, we're right. We're really not only living in a time of, let's say, making progress, but really, we're suddenly living in a time where there's a significant group pushing back the other way,
Yeah,
really.
yeah.
That there are many people sort of saying, I do not accept this. I do not accept that this exists and this is not happening, which is really even an upping the ante, if you will, from what's been happening before. Like, and that fight that you described as being internal has now been externalized.
Well, I think this is where analytic thinking has even widened further. So a number of thinkers, Vermeek Volkan is one, Maurice Apri, who worked also at University of Virginia, both think about traumas in a communal way, in a group way. So in groups, each group sort of defines their national identity or cultural identity on the basis of their history, which often carries with it some mass trauma that the groups have endured. And Apri says that we store these in us so that when we get into these conversations, those traumas that are not only carried intrapsychically, but they're also carried transgenerationally get stirred up. And I would say everyone's resting heart rate and blood pressure go up. And one intervention that I love to do is to have everybody do like yoga for an hour to calm down your resting heart rate, because some of it's neurobiologically encoded. We can't even control it consciously. That's another aspect of what the implicit part is about. Brain studies actually show that, for example, if you show white people black faces, the fear center in the amygdala heights up, even if the person is not even exposed to a situation. So how do we think about it from the biological perspective so that we can also impact how people engage in the conversations? In order to do this, what we do when we teach is we start off in groups with let's start off by getting people to talk about their own identities. One study showed that if you took sort of example, white means white, and I always say, I don't know what that means, because people come with cultures and histories, and white is kind of an obliteration of the diversity even within that category. If we took people who are white identified and gave them measures of their identity, they found that the more able to talk about your own identity and the more clear it is with who you are, the lower your score on implicit bias.
Hmm.
So in a way, the more able flexibly we are to think about each other, is less restricted to categories and more as to who we are. I have less of a need to devalue you. So you talked about analytic concepts. One concept that comes up when you talk about these kinds of group phenomena is that Freud said, I can bring any group of people together in love as long as I can find another group to be the object of their aggressiveness. So that means my team is the best, which means your team must be the worst. And the way this kind of thinking evolves is in groups, that groups tend to think of themselves as better and externalize or push and put all the badness on other people. This sort of is what the founding forefathers had to do. If you read some of the accounts in Volnegay, who's done work on The Pleasures of Owning Persons, is his book, he listened to the transcripts, and they actually had to debate in the formation of the country when they wrote the Declaration of Independence. you find that they were troubled. How do we say we're a nation that's equal and we all still own slaves? They were profoundly conflicted about how you do those two things. So psychologically, how does a good person do that? They have to find a way of rationalizing analytic concept that I'm doing something not so good, even though I want to be good. So I must say those people must deserve this in some way, or must carry negative qualities, or must be of a lesser race so that I can justify that it's okay. So you even see that they weren't bad people. It's pretty famous that Jefferson owned slaves, but who's going to argue that some of the things that he did were not transformative for our country? So if we could begin to think about that, the problem is that there's always going to be a portion of society that wants to hold on to the rage that becomes destructive. That's the other thing that Freud told us. There's a part of humanity that is destructive. How do we harness and control it? I believe that there are always people in the middle who are trying to do better, but they're being in groups. We kind of follow the person who's out lead. How do we get people now to sort of say, I can sort of define that I want to try to figure this out in me and do better? That's not going to change unless we find some way of taking all that we know to both educate people, but then we actually do need to have people come together and do sorts of training that makes people begin to look at themselves. People aren't going to want to do that. How many people come to your office saying, oh my God, Dr. Saltz, I'm having so much fun having you tell me about the things that are a problem?
We always talk about that. There's no treatment and there's no alleviation of suffering without more suffering first.
That's a hard sell.
So that's why psychoanalytic psychotherapy has always been a hard sell. Although obviously it transforms lives, but right, exactly. So on the community level, this is a hard sell. That it's a hard sell to tell teachers and parents that they have to look at themselves if they're bringing up children, if they're talking to children, that they have to be able to look within, deal with whatever internal shame, internal culpability, thoughts that they think they shouldn't have, but maybe do, in order to not bring up another generation with the same issues.
I think that we have to train people on how to do that. I think the mistake that is made, at least I'm in Atlanta, Georgia, and there's a huge backlash in schools about education. And when they do programs going into the schools to teach children about this, the mistake I believe they make is not also working with the parents and children in tandem. There's data about this. Beverly Tenham, who did a lot of work before she was at Spelman, they looked at doing these kinds of educational programs. And you're more successful if you educate kids, but give parents support, education, and understanding. Because when children come home talking about these things, for example, remember the big backlash, I don't want you talking about race and slavery in school. My kid got upset. And I had someone tell me this. I said, you know something? It's like a really awful story. Of course they got upset. But if the parent doesn't know how to talk to them about it, the parent needed support and help too. It's sort of, you remember when they first started doing sex education in school? Everyone went crazy. If you don't help parents also, of course it's not going to go well. So that was poorly thought out to not think that parents needed guidance. And we have enough data to know that. That's the shocking thing to me, that we have so much information and there's a way to do this. And you are correct. It's very difficult. We're starting to do it in the field of mental health now and the way that we train. And in psychoanalytic institutes, we're saying, you know something? We have to help people learn how to talk about this. We have to help people, for example, teach about it. Because in universities across America, people are trying to teach, and these crazy things are happening in classrooms. But in order to teach it, you have to know how people get activated by their traumas. These are reactions based on individual, racial, and mass cultural traumas that we've all endured, that we're probably not aware of, that aren't well thought about in terms of educating people. And if we help people understand that we are naturally going to be triggered if we've had traumatic experiences that we haven't learned to process or talk about, and we're going to collide in our traumas, then that's not going to go well. But if we have the conversation mindful of that, then perhaps we can do it in a way that's helpful. But right, you're talking about sort of a mass cultural issue. I don't pretend, and I hope you didn't hope I would come here with the answer to the entire situation, that we have to start one by one, and we can start in training. For one example, in the mental health care field, people aren't even getting good treatments because bias
I was just going to ask
pigeonholes
about that.
people different places. You don't even get diagnosed properly. If you're Black, you're not even thought of. Like you said, good functioning for psychodynamic treatment. There was a time when people of color were thought of as not having an unconscious and not being able to profit from psychodynamic treatment. So all of these things are even encoded in the mental and in the actual healthcare system. If I walk into an ER as a Black person, I am much less likely to get a cardiac catheterization for my potential MI. So we have to at least start with our system,
Healthcare
with
in
healthcare
general,
in
right?
general,
Right.
are
We know.
we can generalize to educational institutions. And then after we get that group of people who know what we're doing, maybe we can go further, or maybe we need to educate policymakers about what this says about how we have to be mindful of these kinds of initiatives.
I mean, clearly in health across the board, there are so many very well documented inequities, right? Not believing a Black person's pain level is the same as a white person's, or that Black women's mortality is much higher in the OBGYN area than white women. But in mental health, which you've been alluding to, I think a field which feels it's not supposed to have this problem, acknowledging having this problem would be criticizing our own capacities, if you will, right? We're supposed to be more insightful, more aware of our unconscious, particularly psychoanalysts who go through their own psychoanalysis in order to become psychoanalysts. You've been spending time working specifically on that area, and that has led to many fewer people of color being therapists, being in leadership, being in policy setting positions, and much fewer people of color available to treat patients of color who might prefer that because of exactly the kinds of issues that you're talking about. Are they similar sorts of changes that really need to happen in that group?
To me, that's almost simpler because it's a smaller cohort than the world.
Right.
But I think we can impact that with training. You see, I think there are two things. One, people don't realize perhaps maybe the argument is based on healthcare dollars because trauma, all of the inequities that you talked about create a higher morbidity, mortality rates for people of color. Secondly, what people seem to not really understand is that this affects the whole system, not just one group. For example, one thing related to this we found in doing a study in the field of psychoanalysis through the Holmes Commission is that when there are enactments and institutes around racism and discrimination, it's not only people of color who are affected, everyone is traumatized, and it impairs the functioning of the whole organization. And it impairs everyone's ability to say, how can we work together? So it is a we problem, not just an us, one group problem. I think what we're doing now is recognizing in training programs that we can begin to teach about how do you, first of all, understand what racialized thinking is? How does it develop? And I teach about it developmentally because the impact of trauma, and we know this from all the big studies on trauma, depending on the developmental age, has different consequences. The cumulative effect affects people's functioning. And you'd be surprised when people become more sensitive, Black or white, they begin to see in their patients, Black or white, that issues around race are really affecting everyone. Like young people and the next generation is going to be really powerful. They all say, we all want to understand it. I see no division. All young trainees that I see in mental health care want to understand how do these affect. I even, for example, will present cases that have been treated by other clinicians, cases of varying ethnic groups that have been treated by white clinicians, and they come and I'll show how trauma was missed.
Hmm.
And not
Hmm.
only was I, for
Well,
example,
certainly in the time you and I trained, this
yes,
wasn't taught
right.
at
It
all.
wasn't taught at all.
Right.
And I actually, it's funny because I always tell people I didn't go into my career thinking I was going to focus on race. I'm a child clinician, and I was working on how to help the healthcare system with the tremendous need of children and adolescents who are underserved, like categorically. And I began to see that, like, people would say, "How do you know how to say that about race? Do you even, well, how do you know to talk about that?" I was like, "Well, the kid asked me, so I dealt with it." So it wasn't taught before. And now, for example, I'll get cases, and I had one woman come in, and she had a really good psychiatrist, really good person, did very good treatment. And she kept talking about all the problems she was having at work. You're just being competitive with that woman. You got to do this. So this had gone on for years. She'd marginally gotten better, and she moved and she came into treatment. And she had never realized, but in the course of the treatment, what we uncovered is that she had grown up in an area of the South that was brutal. Her family were immigrants. They were Southeast Asian, and they didn't even know there was such a thing as the racism she encountered. And she was brutally, brutally traumatized in adolescence. And this made her have this profound difficulty and anxiety working in groups when people demeaned her or disparaged her. And after we realized the nodal points in her development where the trauma came, we were able to talk about why walking into companies that were not diverse was such a traumatic experience, why it kind of triggered that, and how she felt no one ever talked about how do you do that when people say these mean things to you? Very simple thing. And that improved her functioning at work.
Just the awareness of it. Or is it just the awareness to understand what is happening to you and why it's happening, what's being triggered, remembering and, unconsciously what is being triggered, and how much is needing to then help whoever respond in a way that essentially they teach the other person something about what is happening and why that isn't working.
Well, we're psychoanalysts, right? So we also have to help with what a negative self image she had as a result of being treated so badly because she thought it was her. It was hard for her to understand. This is the amazing thing that you and I know about trauma when you treat individuals. They have the pieces of the puzzle, but you kind of help them put it together and make meaning. Because what happens when we have trauma? We just don't want to know. And actually, on a national level, yeah, we don't want to know. It's a horrible story. But then what you can do is, and I always tell people, sort of, we can focus on the horrible things people say because, quote unquote, microaggression. I said, but you know something? When you're a clinician, your goal is understanding. So, how do you respond in a way that makes you feel you stood up for yourself, but could convert the conversation? And that's a hard thing no matter who you are. And we do know with adolescents, studies show that if you teach Black children and adolescents how to respond in those moments with comments, they're less traumatized. Because the other thing about trauma, which makes it so overwhelming, one is that it's overwhelming for you to cope with, but two, that you feel helpless. And so if you can change that feeling of helplessness in a traumatic situation, when someone has a post-traumatic response, that is helpful. So you not only help the person feel better, but how do we begin to say to each other, look, had you considered what you said to me? But what happens nowadays?
In that scenario, what a lot of research has found, because really we're talking about a form of bullying essentially, right?
Yes.
That the person who can make the biggest difference
Mhm.
is the bystander. So in that model is the education of everyone to some degree to be the bystander who can say, hey, I just heard what happened here. And besides empowering the person perhaps to answer, someone else who can say, I don't know that you meant it that way, but that was unkind or, that was not appropriate.
Well, I'll say two things. I don't like the term bystander, but I will accept that people use it. This is based on some of my own writing conceptualization. I use the term spectator because I think that you are in the situation if you were there. But the term bystander makes it seem like you're just passively observing. But once it's a group situation, we are all there. We choose whether or not to be active. And if you are a spectator of a situation like that, then you are participating in it. That may not be a popular point of view. But I do think group phenomena allow people to surrender their agency and act as if they can't do anything. And I don't know how we're going to change that, but I think it does need to be changed because we are all in it. In order to change that, though, you really have to teach people more about. I don't like the term microaggression. I have a colleague, Anton Hard, whose paper calls it a discriminatory gesture. I think it carries discriminatory potential because it is in the context of a larger culture in which every day we're inundated with racially coded messages that are destructive and that they recapture people's communal trauma from historical events. And I think we need to sort of help people understand what makes it traumatic. Like there's some groups I work with and someone will say, I'm not sure that's so great. And the person will say to me, I was in a group once in a class and a older analyst who was a white man used the N-word. And I sort of typed with Zoom, I typed into the chat, could we stop a moment? And I said to him, I'm not sure you thought about it before you used that. It seemed like you were trying to use it to be illustrative. I said, but it's very hard sitting here because it already increases my heart rate because it's a really trauma-inducing word. And so he thought about it. And someone else who happened to be white said, I pretty much think that we've learned, because they had done a lot of work in their group, I think we've learned that when a white person using that word, it has a whole meaning. And we can't, even though we don't like it, we can't escape it. And so it was really interesting. So then like a couple of weeks later, I got a note from him saying he thought about it and what he thought. And I said to him, it's like really a powerful moment that we can have a conversation, that I can call attention to it. But in a way, I was trying to call you into thinking about it, and that you and I now can sort of say we understood something together that was really hard, but will take us forward. How do we create that? That was created because there was a lot of work that went on in the group about studying how do we understand these phenomena? How do we understand trauma psychologically? How do we understand how we're all in it? How do we understand we don't always want to be there? Isn't it easy with bullying? And I have a colleague in the APA whose paper was about microaggression as bullying, Dr. Cheryl Wills. And if we think of it as bullying, then we think, oh my God, that changes the discourse. Don't we know a lot about how to intervene with bullying? So even these little shifts in frame, because that does something. And in bullying, people can watch it or people can intervene, or we know it's harmful. All of those ways of reframing and thinking to question, thinking together, meaning that we want to think together to get to a better place. But if we want to stay invested in the rage and fight and struggle of it, that's a painful place to be. And it is the case that not everybody wants to. Some people are invested. And sometimes, discriminatory experiences does provoke that rage because there's a moral injury that one feels like one has to keep going after. And actually, it can be a therapeutic advance to help somebody with managing that rage. And I don't always
or
want
even
to
managing the injury,
Yes.
which is cumulative. And as you brought up earlier, as soon as the dynamic of injury and shame take the forefront, it's really an extra obstacle to get through, right? To create
Definitely.
insight.
One of the reasons why I like to think about it as racism is a cultural trauma that impacts us all, but differentially depending on our social location and our identity, is that everyone is harmed by it. And I think the problem with white identified people in our culture being socialized not to think about it is that they don't have the facility and language to know how to think and talk about it. So I think that people carry that. And what happens with trauma if you can't articulate it? Psychoanalytic, we know, Freud said, and remember repeating and working through in 1914, was that if it's not spoken, we are destined to keep repeating it. One way of looking at our society from an analytic perspective is because the foundational traumas have not been talked about in a way that's been helpful, our culture will continue to repeat these maladaptive, destructive patterns.
Or one big repetition compulsion.
It's sort of thinking, I don't know how you're thinking. I was thinking, so when you're an analyst, it gives you a language, at least, to figure out how to talk about it. moving forward people forward. Now, that's always still a lot of work. But like, what if we gave people a language? What I love about the younger generation is they're better at it. I hear college students talking about it sometimes. You know, that's your white privilege, but you know something, I didn't mean it at that moment. Okay, I'll let you go. I heard this in a conversation. He said, you know something, let's just park it and keep going. So they have a language and they can even like go back. I hear adolescents and college students and I think, you give me hope because you can have the conversations and even throw it back. I had a friend of mine saying to me, I said, you know something, I don't know that we'll ever get to a world where there's no racism. I said, you know what I'd like to get to a point that we see it and we can joke about it and move on. Because then we recognize our traumas can be managed in a way that doesn't destroy either of us. That's all we can ask. Yeah, I have a colleague, Wally Fletcher at the Philadelphia Psychoanalytic Institute. He says, we live in a trauma normal world. We don't live in a trauma normal world. We all have traumas.
Yeah.
The problem is like sometimes I can tell you about mine and I can tell you as a person of color, 400 years entitles me to be heard. The problem is that what if we gave recognition to everyone? The reason why the social justice movement continues is that racial violence is ongoing, but also we need to recognize each other's traumas. And that doesn't just mean sort of giving airtime and moving on. I said to one group, why don't we go around the room and everybody gets a moment? But you know something? In that moment, personal revelation, I was raised as a Quaker. And in Quaker meetings, the goal isn't for everybody to keep talking. The goal is when someone is moved to say something, you have to listen, take it in, give it thought before anyone else can speak.
Mm.
And how often does that actually happen?
In this country right now, too much never.
Yeah, there's no time to listen because everyone's arguing. But if foundational experiences around historical traumas and discrimination aren't recognized, but you said it, there's so much shame in that. There's so much shame in saying that we as human beings do horrible things to each other, and we have to look at that and say it has harmed all of us.
Yes. And where there is horror, our minds look for blame.
Yeah.
And I think it's so important what you started with today, which is that the implicit bias starts at this very young age.
Mm-hmm.
And that's really, so to speak, where the money is, right? If we could intervene at that point, and how to do that without blaming parents or blaming, if individuals cannot feel blamed, but feel that they didn't know certain things, that's what you're saying, really, that they didn't know. And in knowing, they can change what is happening in a positive way. That is a real challenge.
That's an analytic idea too. It's so much easier to project it onto your person and you feel it yourself. But how do we teach history in a way that thinks about that? And how do we say, and Freud said this too, that we are all capable of horribly destructive things. And how do we look at history and say, you know, we got to acknowledge that.
And in that, Freud, right, alludes to the desperate importance of socialization. We don't have civilization. And that this is really about that. This is about appropriate socializing, which doesn't always happen.
No.
I thank you for all the work that you do in this unbelievably important, really vital area. And I appreciate your sharing it with us today.
Well, I thank you so much for the time to be able to talk with you. I hope we can think more about it together. Our world really needs greater understanding and more compassion. And I think that analytic thinking allows us at least a way to organize it in our mind to think about it, and maybe think that if we found a way to help all of us with our traumas and find a way, what if Freud did talk about eros, me just a little bit more love to assuage the hatefulness in our world. And that's why I love children. They give me the hope that we can continue to teach people that in a helpful way.
Thank you so much. Thank you.
You're welcome, Dr. Sim.
And now for some Freudian quickies. You sent in your questions for an analyst, and I grabbed an analyst with an answer. Do you always have to be serious in your sessions, or can you use humor?
I think humor is a big part of treatment. It's mostly spontaneous, but also with some foresight when it comes to who's walking into the room.
An analysis can include all manner of things, including jokes and things that spontaneously arise that are quite funny. And it would be really problematic to not allow for the widest range of human emotion and expression in analysis. And that includes humor.
Humor is very different for each patient. How they express their maybe funnier or more ridiculous parts or more sort of silly parts, it's very different. And then how that sort of evokes something in me, I would say, is also very different. And, when you find yourself busting out laughing at something, there's something really powerful in that.
I always think about humor as vital to relationships. Freud wrote a very important book called Jokes and Their Relationship to the Unconscious. Humor in psychotherapy and psychoanalysis sometimes is a way to talk about a difficult subject.
If we are dealing with the psyche and the fullness of the psyche, of course it includes humor. I think I don't personally use humor in a scripted way, but it's part of the person, so it will come into our work.
No, I don't think you have to be serious. I actually think it's sometimes helpful if you're not serious all the time. And humor can be very useful, right? Can tell you a lot about the person that you're working with or how you and them are able to interact with each other. So yeah, no, I think it's definitely a tool to use.
Humor is extraordinarily helpful in both healing promotion as well as just in humanizing sometimes the experiences that people bear and bring from such a vulnerable part of themselves. So without humor, I don't think we could survive in this profession.
What do you love about being a psychoanalyst?
I love the way it brings me closer to people and allows for more meaningful connections.
It's fun and it's really deep and really moving.
I'm curious about people. I like listening to people. I guess I was born a psychoanalyst because I was listening to people's problems from a very young age.
In the practice of psychoanalysis, I get to meet people at such levels of their depth. It's such an honor that they don't sometimes get to share those parts of themselves with many other people.
You'll never know everything. You're always learning from people and with people. And so what a wonderful way to spend your career, right? So there's always something else that you could be working on or interested in.
I love the intimacy of the job, how much it allows us to connect to other humans with such grace and compassion. And it gives me a sense of what makes being a human being so special.
If you have a question, really any question for a psychoanalyst, send it to apsapodcast@gmail.com, and we will try to feature it in a future Freudian Quickie. For more information about the American Psychoanalytic Association, go to www.apsa.org. Till next time.